Hi, I'm Dale Sherbeck, and welcome to the HQ, a CHA Learning and Healthcare Can podcast serial where we dive into healthcare issues and topics from the perspective of its people and discuss them with those that are leading in the health system. Together, we'll try to unpack those topics and learn what actions are being taken to innovatively solve them today. There are a few topics that unite us all, and by all I mean globally, but certainly one is our environment. Whether we're talking about global warming or climate change, pollution of air or water, food supply, wildfires, or catastrophic weather events, we're ultimately talking about the sustainability of our world and the ecosystem upon which all life, and our species in particular, depends. I know some listeners may be fatigued by discussions of the environment. You may feel you get it already, and you may be inclined to hit skip on this because you're wondering, what does this have to do with healthcare or its people? To all of you, I will say, please listen, because you'll soon understand that this is very much a matter critical to healthcare. We'll be discussing why this is a people problem and a problem of health and for health, but importantly, that healthcare itself is part of the problem. It may surprise many of us in an industry focused on health to learn that by some measures, healthcare is in fact the third largest polluter, which is clearly contrary to creating health. But as is the case with most problems, therein lies the solutions, because healthcare is also one of the largest parts of our economy, because it is one of the largest consumers of energy, one of the largest purchasers of goods, and also one of the largest employers of people. Healthcare, therefore, has a huge stake in both solving this, but also has a huge amount of influence in the solutions. And health professionals are themselves critically part of the solution as well. One organization that is leading this is HealthPro Canada, a national group purchasing organization that is committed to making a difference to sustainability and providing health organizations with practical and realistic ways they themselves can make a difference in terms of how they procure products and services. To have this conversation, I'm joined by an exceptional panel of experts, including Kendra Fry, Vice President, Materials Management at HealthPro Canada. In her role, Kendra is responsible for the strategic oversight of several business units, including HealthPro's materials management portfolio that includes its clinical support services, nutrition, food services, capital equipment, and signature services. In this capacity, she drives new strategies to deliver the best value to members. Kendra is a certified supply chain management professional and holds an honors and Bachelor of Commerce in Management Economics from the University of Guelph. Also from HealthPro Canada, I'm joined by Elam Halan. He is the Clinical Director at HealthPro Canada and is a driving force in the realm of sustainability with his rich blend of experience in pharmacy, biotechnology, and business. With almost a decade in the pharmacy and clinical research space, Elam broadened his horizons with an MBA from Oxford University. This global educational journey ignited his passion for sustainability, prompting him to integrate these principles into his professional endeavors. Elam is a seasoned veteran in leading successful digital transformations within the pharmacy sector. He's keen on leveraging his tech skills to nurture environmentally responsible initiatives and bridge the gap between healthcare and sustainability. And finally, I'm very pleased to be joined by Elisa Franz, the Chief Executive Officer of Proc Europe. Elisa's mission is to humanize patient care by creating valuable, collaborative, and transparent health ecosystems. Elisa advises organizations in the healthcare sector from the corporate to startup level on an international scale. And with her entrepreneurial mindset, she brings bold ideas to life, leveraging multi-stakeholder connections across industries with the aim to accelerate digital transformation. So hi, Kendra, Elam, and Elisa, and welcome to the HQ.
Hello, very good to be here.
Thank you for having me, Jill. Very happy to be here.
Glad to be here. So I'm very grateful all of you taking the time to join me today to have what is clearly one of the most important conversations any of us can have in healthcare. And given we have a lot to cover in this massive topic, so let's maybe just get right to it. So Kendra, appreciating that most, if not all of our listeners are coming to this conversation from different perhaps starting points, perhaps we can start with, what does sustainability mean to healthcare, and why is sustainability such a big issue to healthcare?
I think you said it actually in your intro. We're the third largest polluter worldwide of the environment. And I think, in our panic to bring supplies even into as small a country as Canada during the COVID pandemic, We uncovered the fact that there's a whole lot of unethical things happening in the supply chain. And so, for instance, forced labor and gloves made in those conditions, and child labor and all of those things. That's why it's important in healthcare and sustainability.
So maybe one of you could provide, I guess, an example, maybe to help illustrate this as you've been describing, Kendra. What are some of the complexities in supply chain, and as you've been describing around the ethical, social, economics, or the environmental variables that make up production, to maybe help people appreciate what that means?
Sure, absolutely. I think let's take it out of the medical device and drug sphere for a second and focus on something that everybody can understand, the simplicity of a cotton t-shirt and the production of a cotton t-shirt. It seems super straightforward, but there's a lot of complexities involved in that supply chain, along with numerous ethical, social, economic, and environmental variables. So as an example, you've got your raw material sourcing, and the first step is really obtaining the cotton for the t-shirt. The production of that cotton involves social aspects like fair labor practices, ensuring workers' rights and fair wages. There's ethical concerns if the cotton is sourced from regions where child labor is prevalent, or if unsustainable farming practices are used, which impact the environment, of course. In the manufacturing part of the supply chain, after the cotton is harvested, it needs to be processed and spun into yarn, followed by fabric production and dyeing. And this stage includes factors such as safe working conditions for factory workers, fair wages, and compliance with environmental regulations. The use of toxic dyes, for example, or chemicals can harm both the workers and the ecosystem. So there's crossover in each of those areas, environmental and social. On the assembly and packaging part of the supply chain, once the fabric is actually ready, then it goes through the cutting process, the sewing and assembling to create a t-shirt. And of course, that step involves labor conditions and worker safety and fair treatment. Then there's the packaging materials, such as plastic bags or the tags that go onto the garment. All of those things contribute to waste generation and environmental impact. Next step would be the transportation. So the finished t-shirts need to be transported from wherever the manufacturing facility is to the distribution center or the retail stores. And that process involves fuel consumption and emissions and logistical considerations. And ethical concerns may arise if the workers involved in the transportation face exploitative conditions. In the retail and sales, kind of close to the downstream supply chain, you've got factors like fair pricing and marketing ethics and customer satisfaction that all come into play in terms of social responsibility. That would include providing accurate information about the product's origin, the materials that are used, and the manufacturing processes that were used. Economic factors such as profit margins and fair competition can affect the pricing and the availability of the t-shirt. And then once it gets to the consumer, the use and disposal of the t-shirt comes into play. And so consumer behavior becomes very important there. Ethical choices involve kind of proper care and usage of the product, reducing the waste and recycling, or donating unwanted clothing. Environmental impacts arise from the disposal of the t-shirt with considerations like landfill waste or the energy-intensive process of textile recycling. So end-of-life management comes into play here, and that's managing the disposable or the recycling aspects of the t-shirt. That's where things become critical. So ethical and environmental factors such as encouraging responsible disposable practices, promoting circularity economy models, and reducing textile waste. Kind of the big message there is high quality. You don't want to be buying fast fashion and sticking more into the disposal and landfill and making that process of recycling a lot quicker. Quality garments last longer. So that kind of from start to finish of the whole supply chain of a cotton t-shirt involves numerous complexities, right from the start, right from sourcing the raw materials, right to the end of the life stage. I hope you picked up on the ethical, social, economic, and environmental variables that intertwine with each other at each step. And so there's careful consideration that's required in responsible practices throughout the whole supply chain.
Yeah, I think one, you've very well demonstrated that it is a chain. There's a lot of links and all of that along the way. And I think anybody who's been in terms of doing sort of root cause analysis, and I sort of envision the sort of fishbone diagram with all these different elements that are impacting, right, the production and consumption of that product. But when we talk about sustainability, I guess it's a very subjective or normative sort of statement in terms of something being done sustainably or not sustainably. And how do we really evaluate what that is? I mean, can you put words or something to that helps us to understand is something being done sustainably or not?
You're right, it is subjective. I think, at HealthPro, we developed a scorecard that measures key areas within the pillars, each pillar, sustainability, the social, the economic, and the environmental. We tried to keep it as binary as possible in the scoring methodology. So, for instance, and I'll talk about the latest version of the scorecard that we've done because it's not live yet, we're collecting feedback on it. But in the environmental area of sustainability, we're measuring the greenhouse gas equivalents, or ECO2s. And we've broken it down into scope 1 and scope 2, as well as scope 3. So scope 1 and scope 2 are its own question. And there we're looking for year-over-year reporting of the emissions, just for scope 1 and scope 2. And there we're awarding points in a particular RFP based on the percentage decrease in year over year when sales are normalized. Obviously, if you have more sales in a particular year, your emissions would likely go up. So normalizing sales, you can see what the true impact of any environmental initiatives have been with respect to carbon emission equivalents. On scope 3, we've added a question that is really about, it defines scope 3 emissions, it defines all of the different points within the supply chain where scope 3 emissions will be present. And we're just asking if suppliers measure any of those and which ones specifically they measure. Then points are awarded, it's not points on a yes or no. Obviously, if you say, no, we're not measuring that, then you don't get points for the next section. The next section awards points, and it's based on how many of those different aspects within scope 3 emissions are you actually able to track and measure. And so it's not empirical. It's not about the actual number, because getting arms around scope 3 emissions is the progress and the evolution in itself right now.
Thanks, Kendra. So Alam, there's obviously a lot in terms of our supply of products, I guess, that are coming into our healthcare organizations. Based on your research and I guess your studies as well, what are some of the different myths and assumptions that we make in healthcare that perhaps have larger consequences that we haven't really thought about?
So I think, Dale, somehow we've got to a point in healthcare where we feel that sustainability and healthcare can go hand in hand. Mm-hmm. One of the largest myths we have is disposable is better. More high tech is better. Somehow we've decided to ignore the amount of pollution that pharmaceuticals create. And one of the newest ones we have is digital healthcare doesn't have an environmental impact. And the latest one being climate change doesn't impact healthcare. And, we can attest to the example of how the recent forest fires had a huge impact on people's asthma and other respiratory issues. Going back to the disposable one, that is probably one of the biggest challenges that we have to encounter in the next little bit. And we saw a lot of it. It came to the forefront with all the PPE that was expected to be utilized during COVID care, taking care of patients with COVID. Single-use disposable items, there's a large influx. You can go anywhere in the world and you see gloves, masks, other PPE equipment lying around on the ground. and it's causing a huge issue. The production, disposable, and waste management of these items has significant environmental impact, and also on the amount of pollution that they create. What we need to shift our thinking is, it's not only disposable that's clean. There's other ways of getting to clean. Reusable can be clean. And we're seeing this shifts slowly, but there's still a large amount of resistance towards multi-use equipment in healthcare, and that causes a lot of waste. That's the one thing. The other one is more treatment is always better. We tend to overtreat conditions. We tend to overlook approaches that are preventative rather than curative. And that is having some huge implications in the way we deliver healthcare as well. Social determinants of health are a major factor that can reduce the amount of healthcare we have to deliver within the four walls of our healthcare system. And speaking of four walls, that's another myth that we have going on, is that in order for us to get healthcare, we need to go to a specific kind of building. We need to either go to a hospital, we either need to go to a clinic, we either need to an X-ray facility. And things are changing with the large push that we've seen in the telemedicine and the digital health space. That is all shifting. During COVID, we figured out how to do a lot of these things without moving the patient around. And what we discovered is the less we move the patient around and the more care we provide within the four walls of their home rather than the four walls of their healthcare facility, the less environmental impact we have. And the other thing that we've done is we've created technology, going back to the point of high tech is more better. We've created technology that neglects, just like other things in healthcare, has neglected the healthcare impact. We have energy efficient home appliances that perform a lot better than the commercial medical equipment that we use. The shift is there, but the pressure for them was not as big as we saw in the consumer market, but that's all changing. Hospitals are required to be monitoring, reporting on their energy consumption, and we seeing a lot of emphasis being placed on energy efficient infrastructure, optimizing their usage, and adopting renewable energy to reduce the healthcare sector's carbon footprint. So those are some of the things that we see that are happening in the space to recognize the myths and then work on the PR side of things so that people understand, but also have the technology available to replace some of these issues that we've recognized.
There's a lot in what you've described. I mean, in some ways, you describe the way healthcare itself is invented and delivered as being really part of the problem, right? In terms of our acute systems, our focus on disease as opposed to prevention, the way we deliver the care in those spaces. So yes, I think when we talk in other spaces about a transformation of our health system and how we talk about sustainability, often we're talking about dollars and cents and the people. But I think what you're clearly drawing a linkage to is that it's not. It is also about the environment when we talk about sustainability.
So Dale, even when it comes to dollars and cents, it just depends on how do you measure dollar and cents. Like, it's cheaper to give medication for someone, let's say for the asthma, going back to the asthma example, but using like preventative medicine, preventative healthcare, social determinants of health, you don't see the dollar impact in the short term of things, but you see that when you expand. The same thing can be said about when we look for cheaper products, cheaper materials to be used in healthcare. Yes, in the closer sphere, if you just look price as a marker and you don't look at externalization of cost, you're able to get a cheaper product. But if you expand your horizon, you look at all the things that were not accounted for in that low price, you do end up spending more money in the long term. You do end up harming other places that then come back to impact you. So even dollar-wise, it makes sense to be sustainable. And we are seeing that shift in a lot of corporations and a lot of non-healthcare businesses. And it's just a matter of time before healthcare starts to realize how they've been externalizing costs, not even just in the production of healthcare products or pharmaceuticals or anything, but even the patient care itself. You need to look at the bigger aspect, the long-term horizon. And then you start to say that it makes sense to be socially responsible. It makes sense to look at the social determinants of health. It makes sense to procure products that are sustainable for our environment from every perspective, including the dollar value.
That's yeah, I think, and it's a good addition, and I think it segues into my next question as well, because I mean you're certainly focusing on the importance of language there. So maybe I can move to you, Elisa, from there. And so, as we talk about sustainability and environment and the impact that language is in terms of how we choose to define that, and I think Alam's just made some good points about that. It certainly helps us as individuals to really understand, I guess, what we're talking about and to make it personal as opposed to this larger, allegory about something else that's happening to someone else somewhere else. So based on your experience about what's happening perhaps in Europe, given your space, what would be your advice and perspectives on this and how it's being managed on your continent?
Well, first of all, Dale, thank you for the question. And before going more into detail, I would really like to connect back on Alam's input, because I think this is really what we're talking about. Mm-hmm. And I would also say that to not even make this problem bigger, but this is definitely a system question, because how our healthcare systems are being set up, it doesn't help us to drive sustainability actions in the sense of creating incentives, creating benefits to actually rethink how healthcare is being delivered. And I'm here talking about the long-term strategy, looking into what does really value-based healthcare mean? And does that mean like treating sick care? And also the questioning of how we deliver healthcare, of what Alam mentioned. I think we're very much only into treating the consequences that actually, if we want to make that very short, we're causing as a healthcare sector. So I fully agree that also looking into how can we rethink that system, we need to start from a healthcare perspective. And coming from the European space, let's say, what we're trying to do with bringing a focus on procurement professionals in healthcare, they're so keen for us in actually coming and starting acting as catalyst for making this a game change. Why? Because if we're looking into the scope 3 emissions, and if we realize that actually, 70%, something about that, accounts to what is been bought in terms of goods and services, well, this comes down to procurement. And this is here where we need to make sure, and this is what we're standing for as HealthPro Europe Association, is creating that common knowledge, because we have a big knowledge gap. And I wouldn't say to focus on the good things and let's say focus on the opportunities. This is not a problem as such in the sense of we're able to solve it. It's a problem if we ignore it and if we think we want to continue as it is right now for the future, because I think this is very short-term focused, and for me it's something very hard to believe. So what we're doing as the organization is really to create that common language by bringing together the procurement peers, by establishing commitment from the top level management, because also this is here where we need to implement strategies on sustainabilities. I'm very a fan of, I would say, very pragmatic actions, but we also need to have the commitment of the C-level. And this is, for me, how we need to shift the thinking of healthcare procurement in being purely administrative, but rather actually having a strategic role to play in supporting decision-making of what kind of products and services are actually meant to support sustainable healthcare organizations. And speaking from a European side, there is a lot of good examples, yes, but there is still a lot of things to be done. And I would say, like, from my practical experience, I mean, working in projects with hospitals, I do lack that that passion to drive this, like from a procurement perspective, because there's so much focus still on price. And I think it's still focused so much on, I would say, a negative competition. So why don't we act as leaders from a healthcare procurement side, take that relationship building with suppliers and tell suppliers what we want? I think we are very laid back, I would say. I'm talking from that part of the roles we're taking, in the sense of just being reactive. I think it's time for us to stand up, speak out, and say how we want this to take place, in understanding the procurement role as, well, the game changer to really create the transparency of data, create transparency of what is being bought, and help others from the healthcare organizations to understand what it actually is, because it takes a lot of courage. And I think it also takes a lot of cultural transformation within the organization to make that change and make that efforts. And with all the, I would say, other challenges and crises we're facing, this is a very difficult one, but I think it's a difficult one looking into short-term perspective, and there is nothing to look like short-term. I think this is a topic we need to handle. I think being in healthcare, we are at the forefront. I think we should be pioneering this, because for us, health is like the outmost pillar of being. And this is what we want to serve. So therefore, to come back to your question, I think we need leadership on very different levels. We need leadership from the people who are actually acting as procurement professionals in the field. We need leadership of the C-levels to actually guide and give a strategy of where this should go to. And then we should be very humble of looking into what can we learn from each other and how can we exchange of what we have been doing, and also be honest about what doesn't work. Because I think this helps us so much in the sense of not repeating the mistakes others have been doing, and there's nothing wrong in doing things wrong. I think this is absolutely great in getting it tried out, getting it tested, and then realizing, okay, this does not work, but we did it. We didn't just sit there, we didn't just sign pledges and hope that the pledges would solve our problems, because they don't. So summing this up, for me, this is really about creating connections and collaboration within the organization, across your suppliers, and even among the procurement professionals across different countries. So this is what we're here for. And this is actually, if I might mention this, that we have created an initiative between HealthPro Europe and HealthPro Canada to embark with some first selected countries to better understand how are group purchasing organizations performing on sustainability actions, what can we learn from their hospital members, and how can we bring that together to really, I would say, drive that exchange and drive the conversation and learning together. I would say is such an important fact here, because we don't know it all, and I would say we know very little. So I think to ramp up and accelerate our learning experience, this is the only way how we can get it done.
Thank you, Elisa. There's a lot of brilliance in what you've described there. Certainly, I mean, you've emphasized the importance of systems in this, and that, I guess, and healthcare is not an island unto itself, right? It works within a larger series of systems, and the leadership and the people that are involved in that. And I do appreciate the emphasis on procurement leaders being sort of critical to the solutions here, and being valued perhaps as parts of a larger strategy. One of the, I guess, the things that each of the three of you has mentioned so far, and maybe I can just ask for someone to provide a bit more of a definition of this for our listeners who maybe are not as attuned to that, is the descriptions you've given around scope 1, 2, and 3 emissions. And what is the difference in that? And I mean, I think I understand that you're in some ways describing the supply chain itself. But maybe since, Elisa, you've been giving us some definitions and the importance of language on that, I can ask you to sort of provide us some more clarity on to what that might be, if that's fair, or maybe somebody else in the group.
I would actually love to hand it over to someone else to go a bit more into detail.
Alam?
Sure, I can take a stab at it. Kendra, feel free to help me out over here. So the difference between the 2 and the 3. So basically, if you look at any company, any organization's emissions, scope 1 is coming from sources that a company directly controls.
Mm-hmm.
So those were the examples would be basically any machinery that and any sources that they produce to end up with an end product, and they have within their control to be able to change that process to reduce those emissions.
So like the emissions that are coming out of a boiler or a stack at a hospital itself.
Well, depending on how, yeah. So whatever is happening with their final end product. So let's say they're making PPE, and they're using a particular kind of material to produce the PPE. So whatever emissions are coming from that production process itself, that is scope 1 for that company.
Mm-hmm.
The reason I mentioned for that company is because things will change as you start to verge into scope 3 when you started talking about their suppliers. Someone's scope 3 might be someone else's scope 1 emission.
Mm-hmm.
Moving on to scope 2 is when the indirect emissions from things like the electricity that you're using within your building, the heating and the cooling that's happening in your building. So those are indirect emissions that are coming from, resources that they purchase to produce their products. So that falls under scope 3. Scope 3 is sometimes when you use third-party companies to do work for you. So that is still generating emissions that is related to the work that is integral to the part of the company, but that falls outside their scope. So generally, we see that companies are really good to handle their scope 1 reasonably well and started to understand scope 3, but struggle when they start to look at scope 3. But then again, that's where partnership comes in, because the scope 3 for a organized third-party organization that you're using, it's their scope 1 emission. So that's when you need to have those conversations, when you start to build collaborations and partnerships to work together with your partners. And that's when you start to work on, when they start to work on their scope 1, it also indirectly reduces your scope 3 emissions. And that's where partnerships come in really handy.
Thanks, Alam. You wanted to add something to that, Kendra?
So just expanding on some of the examples, you're right about that kind of boiler room example. Scope 1 is everything in your control, basically. So that could include as well, like your company-owned fleet of vehicles for a sales team, any kind of on-site power generation, or anything that you can measure from your own internal industrial processes. The scope 2 emissions are associated with generation of purchased electricity. So that's really activities occurring outside your operational boundaries, and they're related to energy consumption. So they're considered indirect because emissions occur at the facility where the energy is generated, not at the reporting organization's location. Again, easy to measure, very empirical. We've got the systems in place to track that. You can track that through your utility providers. Scope 3 emissions, that's everything else. So that's the one that is like 90% responsible for emissions, and it's considered indirect greenhouse gas emissions, and it occurs as a result of the organization's activities, but they're not included in scope 2. So not owned or controlled by the organization, but related to its whole value chain. So if you think about that cotton t-shirt example I gave at the beginning, it's all the upstream and all the downstream activities that would be part of scope 3 emissions. So you really have to have supply chain transparency to be able to get your arms around that and be able to report on it. I think vertically integrated companies have it a lot easier in being able to find those different sources. But for the most part, when you're not vertically integrated, it's very difficult to get arms around that and be able to report and reduce and find better strategies. So they tend to operate more at a high level when it comes to implementing sustainability initiatives.
Yeah, so that I think in the supply chain management side, I guess, is when a product is being manufactured in another place or by another company, it could be through a high intensity sort of production process that perhaps uses a lot of energy or has a lot of other kinds of emissions. And there can be some that manufacture that same product using less energy and less pollutants, and that would be the difference between how you measure those from your perspective for your scope 3. But I think, as you've been describing, Alam, for that company itself, those are scope 1 emissions because they have direct control over them. But your choice to use one supplier over another supplier would change your own utilization, I guess, or your scope 3 emissions impact. Am I getting that right?
You're absolutely right.
You're
Yeah.
right.
So, and that's exactly what we're seeing. So that's where we see the difference between companies that are ESG aware and the companies that are deciding to ignore it in terms of short-term profit. So your choice of your supplier, and sometimes those suppliers are not at the same level. So you of understanding their ESGs and working with that, and that's where some companies chose to partner with their suppliers, work together, versus other companies have decided to ignore it. And that's where we're seeing a major differential between the two kinds of companies. Ones that are actively working on their scope 3 through partnerships with their suppliers, and the companies that are deciding to ignore that and either planning to tackle it later or for financial reasons deciding not to look at it.
Right, and then coming back to the points that yourself and Elisa, I think, were making, and choosing perhaps a supplier that is selling a product cheaper may come at a greater emission cost, and therefore cheaper isn't necessarily better, I think, as we've often hear. But Alam, I think you touched on it a little bit more, but maybe just to sort of probe on that, perhaps more if you want to add more. How does the question of where and how healthcare is delivered impact our sustainability?
Yeah, so it's again about how stretched your supply chains are in terms of procurement. The more supply chains you stretch, the more resources that you use, and we see the same thing in healthcare as well. In most cases, we see a patient would have to go to multiple places in order to accomplish one healthcare visit. For example, they can go to the family physicians who can refer them to a specialist, and then further on, they can be referred to some diagnostic testing. And as you can imagine, all this generates a much higher carbon footprint versus if we are able to deliver healthcare with a sustainable hat on, when we start to account for the patient's time, for the patient's travels, and all those kind of things. And traditionally we haven't looked at them. Traditionally, we've always thought it's cheaper to compartmentalize and deliver healthcare in a batched manner, but we're seeing how that quickly unraveled during COVID. And also looking at that medical facilities that we always strive for is one place with all the facilities, but that also starts to produce concentrated pollution. It does produce concentrated healthcare, but at the same time, it also produces centralized pollution. And that is another theme that we are seeing. Healthcare systems have acknowledged it. We see ER visits in Canada and Ontario delivering medicine services for the patient as well, which is a first. Before pandemic, we never thought it would be possible for you to be able to have a telemedicine visit with your hospital, just because the way the financial incentives were in place for the hospitals to deliver the healthcare. But COVID, with some of the positives that we've seen through it, has decided to open up a whole different way of funding healthcare. And with that, we're seeing more and more of that happening. It remains to be seen which way we go back as the pressure from the pandemic is lifted. But overall, globally, we're seeing that a lot of gains that we saw in telemedicine and delivering healthcare where we account for patient's inconvenience and what works best for patient. We're seeing a trend in that direction to continue.
Thanks, Alam. One of the, I guess, the questions in terms of the use of telemedicine, perhaps, and I think an earlier point you talked about the move to digital healthcare. And I'm not sure if any of you sort of maybe feel comfortable to weigh in on this. I know it may be a bit more complicated, but the healthcare for the last, let's say, decade or two has been moving towards a digital transformation as we describe it, like the rest of our economy, but certainly a move from paper, paper charts and paper information, all this right into a digital space. So, we're saving trees on the one hand in this move to putting everything in a digital format. Is that better? And what are the consequences of that in terms of our sustainability and our environment?
Can I take a stab at this one? This one's really close to heart for me.
Sure.
I actually spent the first 22 years of my life in India. One of the things that I noticed that was different over there compared to over here was over there, it was a paper charting system, of course. That was the 80s and the 90s. But what would happen at the end of that interaction was whoever the physician was, they would hand that paper copy back to the patient. So every patient would carry around their own chart with them. And that just became their responsibility. So every family member, every household member, they would have their own chart. They would go to different physicians, take the chart with them. The physician would contribute to that chart, and the chart goes back to the patient, and the patient decides to give it to whoever they want to. So when I came to Canada, I saw, that was 2007. So at that time, we saw computers being used in clinics, the documentation of the chart, but that chart was never really shared with the patient. It was more for the healthcare provider to maintain their own records. And that's when we start to see a lot of issues that we saw. There's collaboration of care. We're delivering care to the patient, but patient really has no access to the healthcare record. And it was all fragmented because every place they went to, they maintain their own paper copy or even electronic copy. It doesn't matter, right? So we're still trying to solve this issue. But the patient's own patient-controlled health record is another movement that's gaining momentum. The North American market is a little bit at a disadvantage because what happened here was we got to computing sooner than some of the developed countries. So because we got to the computing sooner, but the computing power and internet was still new. So we got computing before we got really before we unleashed the power of the internet. So what happened was we started to make electronic copies of the paper record. It's truly not a digital system. It's just an image file of a thing that looks like paper, and it's technically is still paper. So we did it that way. And then that kind of became known as a digital health record, but it's really not. And that fallacy has done more harm than good, because if the yardstick that you decide to measure digitization of a healthcare system was how many physician offices are using electronic charts, it's pretty high. But how many of those charts are truly digital and can be shared seamlessly with other providers? Then that changed the whole perspective. Then we are far behind with some of the developing nations, which never made that transition to the paper to the scanned version. And they've actually just jumped from using paper to using truly digital system. So they have an advantage of not dealing with the friction of what we're seeing in North America. And coming back to your point, so that's a struggle that we deal with. Once we get to that point where we see that healthcare records are truly empowering patients. I'm not saying freely available because the privacy concerns and everything, but there's ways around it. We have technologies that can allow, going back to my initial example of patient controlling their own health record, holding it in their own hand and deciding who to give it to. We have those technologies in place. Once we start to utilize them, we'll see a lot of impact that we didn't see with the first iteration of our so-called digital or digitization of health records.
Thanks, Alam. Yeah, you want to add something to that, Lisa?
I would love to add something here because I mean, I fully echo of what Alam is saying. I'm also from a rather German perspective. So I think we have been since more than 20 years trying to digitalize our patient records. And I think the question here around sustainability in a broader sense, for me, is about transparency, is about ownership and accountability, that actually we do not repeat treatments and scans that are unnecessary. So I would say in that sense, it actually attributes to being more sustainable, how we do healthcare, because we know what some other institution has been done. Right now, how I can see that it's so siloed, rather in missing out one activity, we do that double. So I think that's not very helpful, neither for the economics, nor for the patient, nor for the sustainability. And I think digitalization can do a lot to actually help us bridge certain activities and create that interconnection between primary healthcare providers, the hospitals, the home care. And I think that interconnectedness is a key towards a more sustainable healthcare system. Of course, we shouldn't forget, yes, every search we're doing, every electronic device we're using, we're also, creating emissions, not said that, but I think it can reduce the double work, triple work that sometimes has been done due to a better overview of what has been already performed. And then looking into, and I just want to give a good example because I was very impressed actually how Portugal has been doing this, being a very centralized healthcare system. They have a lot of information on how does what kind of hospital do perform, who is working in what kind of hospitals. And again, obviously, privacy is always embedded in all these information. There is no question, but they have this overall view. And I think that helps so much in taking better decisions from a strategy point of view, from a national healthcare system into like the different healthcare institutions. And here I do believe that looking into our public healthcare system, and I think we account within Europe for like circa 15,000 hospitals, there is a lot to be done because we're not connected. And then if you move within Europe from one country to another, no one knows what you have, how you should be treated. There's a couple of agreements among certain countries that have bilateral collaboration where this is possible. But if I would go on summer holidays from Germany into France and I need a prescription, well, you tell me how I get this, because this is very difficult of actually making sure. If we would have a digitalized system, that would definitely help to be a more harmonized and a more interconnected system. So I wanted to share this to just support, and I don't know if you hear that, but like a bit the frustration of why are we not able to do this? Because technology is there. It's not a question of technology.
Yeah, I'm smiling a little bit because I think what you're describing is in Europe, which is right, a continent with many countries, is what happens in Canada, a single country with 13 provinces and territories, where we can't do the same thing that you describe, even though we are the single country. So, anyways, it seems like a bit of a wake-up call. But I'm talking about, I guess. So maybe segueing from what you've just been describing, Elisa, and moving to you, Kendra, around transparency and how we use all that information for making decisions. How do we make better decisions in the space that we are in right now, Kendra? Oh, you're on mute again.
I don't know why I keep putting myself on mute. I think awareness is probably the first step towards better measurement, more informed decision making. At HealthPro, our scorecard is designed to assess an organization's sustainability footprint as opposed to sustainability at a product level. So you're choosing basically in a particular category to work with a supplier that has, essentially better sustainability in terms of what they're doing than, supplier B. That's kind of at a high level. I think when you get more, so once we kind of get past that and it becomes more socialized and more accepted, and we're able to take attention and focus away from pricing and put it more towards sustainability and even embed sustainability into the costing model, that's kind of the next step. I think when you're dealing with a well-established market and the same players over and over again, and you have to go out public tendering, you have to go to RFP, you have to make decisions based on how those responses come back and the scoring process. I think when you're working with an established market, you can actually take some of those points away from product quality as well, because they're meaningless when all the players are kind of the same. Again, very case specific and established markets only, and you put more of that towards sustainability. Right now, sustainability has maybe 5% attention on the overall scorecard, 10% is pushing it. I know there's some countries in the world that are, advocating for 30%, but until it becomes, I guess the message there is the majority of what it is that you're looking to do in how you make your decision making, it can't just be a small part. It really does have to be the leading factor in how you're making a decision.
Thanks, Kendra. So I think as we're talking about, I guess, supply chains in a more, I guess, personal sort of mode, I guess, for many Canadians, the pandemic certainly brought the word supply chain to the front of most of our conversations when we realized that we didn't have enough of whatever, right? Whether it was in our grocery stores, things started to run out, or we would hear on the news about, the challenge of getting masks from China to be able to outfit our healthcare workers. So, what has been the impact of all this on supply chains, I guess, in terms of your work, or more even in larger sort of, transnational conversations? Where does it lead us now, and where are the conversations going to keep going, Kendra?
I think with respect to PPE, and I would honestly say that the ensuing supply disruptions, because a lot of this started in COVID-19, and a lot of it started pre-COVID-19. But I think COVID-19 really brought to the forefront the need for resilience in the supply chain, transparency and collaboration amongst all the different players. It highlighted the importance of building domestic production capabilities, and you can see governments putting forward policy to enhance domestic production capabilities and support those markets. It put attention and spotlight on diversifying your supply sources, so don't put all your eggs in one basket. Ensuring the availability of critical supplies during emergencies through stockpiling. But one of the downsides of stockpiling is if you don't have proper inventory management protocols or even services in place, all of that product is going to landfill or recycling. So huge environmental impact. So it's not just stocking critical supplies, it's the whole management of how that works and being able to rotate that inventory and use it in regular circulation as well. And moving forward, our discussions need to focus on strengthening supply chain resilience, which many of them are. There's a number of government initiatives under the way and various associations within Canada investing in local manufacturing. And I know, at least in Ontario, with the Building Ontario Better initiative, that the government is focused on, that is definitely a priority for Ontarians, improving transparency and, of course, addressing ethical concerns within the supply chain to better prepare for the future crisis. So one of the things I mentioned at the beginning was nitrile gloves and the forced labor conditions in which they were made, many of them coming from Malaysia. So there's actually an act that received royal assent that's going to start targeting that and actually not be accepting products into Canada. So that's actually becoming mandatory now. It's no longer something that you have to measure indicators for. It's a really positive step that starts in 2024. And that means, that particular question within our scorecard can then shift onto another key ethical concern within supply chains.
That's a really positive example and really great news. So thank you for sharing that. So, Elisa, Alan described, I guess, how existential sort of all of this really is to us. But we certainly can see from the choices that we're making that that we struggle, I guess, individually and even, organizationally, nationally, about making some of these things a real, true priority, which is, I think, necessary to really bringing about change. So, again, bringing on your perspective in Europe and your own research and experience, how do we make the topic of sustainability a priority? And how do we, I think, if you described before about the C-suite and getting our leaders involved in this, any advice in that respect as well?
It's a very tough one, Dale, in giving some advice, but let me try to share like a little bit of what I'm seeing and where I believe that goes to, because that we have been looking into, we need to rethink healthcare systems. I think that is a very long discussion, so this is not where we need to start. That's a more trajectory, I would say, into the hopefully near future, but we need definitely engage with policymakers, also from the healthcare provider side, like what is needed in order to have the right policies, the right guidance, to actually incentivize hospitals to do change. I would say this is one. And also here we know, and I don't want to go into detail, but policy might not be the quickest. So I think there needs to be different actions going in parallel. So meanwhile, policies are being shaped, and we can see quite some efforts here in the European space, looking into how can that look like. Also from a fair point of view, I would say, how do we not disadvantage smaller organizations, bringing up like tougher guidelines, how do we deal with CO2 taxes? I think that's all very valid conversations that are happening, and I think it's also important that we define like the policies that help us become more sustainable as healthcare providers, healthcare organizations. And in the parallel, I think this is for us as healthcare professionals, like really stepping up and making this, I would say, an agenda topic already today. And that means to me that the C-suite in hospitals needs to put sustainability on the agenda, because if it is not about health in a hospital, then what is the hospital for, right? And I think the challenge here, and I would say I fully like feel that also like from that very difficult point of view, where do you go in terms of this is your budget and this is what expected from you, and this is a quite stretch. So how do you manage that? But I would say that is also a very difficult question to be solved. And I think this is also where the policy making needs to come in to actually incentivize these kind of behavior and incentivize these kind of actions. But in the meantime, I think it's such a important topic also looking into how to attract talents, how to retain employees, because being in the healthcare space, this is what people sign up for, working in that area. So I think being pioneering, putting that on the agenda, bringing that into the operations and actually setting clear targets of where you want to go is absolutely helpful to define, I would say, structures, like organizational structures that make that happen, that really bring that into reality. And I just want to bring back that number of the 5% that actually the healthcare sector emits in terms of global emissions. This is double as the aviation sector. So like, if this is not a call to action, I mean, I wonder what really does move us, right? So for me, this is about leadership. And as I mentioned before, not only C-suite, also us as individuals taking ownership and being accountable for what can we do better. And I also want to build up what Kendra was saying in terms of the awareness. I think we need to build skills because we do know too little. So we need to invest in the organizations, bringing the right team members on board, bringing also the right innovation actually into the organization to do change. And tying like everything what we're doing into the question around sustainability. I remember these discussions taking place when we were discussing digital transformation. I have the impression we're back to that same discussion. We changed the topic, and this is not about, I would say, hiring one sustainability manager, but this is really like making a shift towards like everything what we're doing here. We want to strive the sustainability decision making, and this step by step. We are not changing everything from today to tomorrow. And I think this is also for me a call out that due to the complexity, it's like starting small, but looking into what it is that we want to achieve. And this is for me the leadership that needs to set out the strategy to actually help the teams to accomplish with very concrete actions and measures of how we can improve from a healthcare provider side.
Yeah, and I think it makes very good sense, Elisa. I mean, and from a leadership perspective, in terms of developing cultures and values, I guess that everybody else operates under. I can certainly relate to, a different part in my own career when I worked at a mine in Canada's north, and I can't remember what the actual percentage was, but it was somewhere between 20 to 30% of the cost of operating that facility was its energy consumption, because everything had to be brought in. All energy was burnt on site. It was all diesel, and it all had, right. So they had a huge impact, I guess, coming back to our conversation earlier, on their scope 1 emissions. But it was also their greatest opportunity to save money and improve their profitability. And so they had an initiative to engage all members of the organization, at 1,000 people, for ideas that could be brought forward to reduce their energy consumption. And so you had, everybody putting 1,000 people putting ideas into a suggestion box that would ultimately go up the food chain to be implemented as ways to reducing costs. And I would suggest that some of what you've been describing here is trying to engage our own healthcare organizations and system in a similar sort of opportunities for innovation, not just coming back to your point around cost savings, Alam, but ultimately around the sustainability of our health system and the impact, I think, as you're describing, Elisa, that it has on our global environment. So yeah, there's certainly a lot in there. I think you guys are all describing exceptionally well the systems that we operate in, and that nothing is sort of separated from that. And the important role that our leadership has to have, starting with dialogue and conversations, as you've been describing. So what hope can you bring to us in terms of what is happening globally? Because there's been certainly, I think, a lot of conversation here on the problem. I think people will finish this podcast understanding, we have a problem, and healthcare is part of it, and it's certainly part of the solution. But what's the glimmer of hope that we can give to our listeners here, Alam?
There's definitely more than a glimmer of hope here. I don't want to end the podcast on a low note, but there's a lot that's happening. The one good thing we have going on in healthcare is we focus on people already, and there's only 2 problems in the world right now. There's only 2 real problems. One is people, and the other is planet. And healthcare already has a strong people focus. So we already have half of our focus right. And sustainability is something that is a focus of most, if not all, healthcare organization. It's just the how to that's where they get it wrong. It's not that they don't want to. It's just the path is very convoluted. And that's greenwashing and those kind of things haven't helped. But we've made mistakes. We learn from them, and we are trying to get the focus right on both these problems, the people and the planet, at the same time. The other thing we have good that's going on for us is there's a lot of industries that have done this right, for-profit industries. So we don't need to fight this without having an understanding. The one cautious thing is, in healthcare, we always try to replicate, and that's where we make a mistake. Healthcare is different from other industries. Solutions that work for other companies when we try to replicate in healthcare, they don't work well and we give up and then we say healthcare is different, doesn't work, move on. The thing we need to do is we need to reapply the solutions that work for the other organization, other industries, and that's where things start to get interesting. When we see what they've done right, we analyze it, how we can utilize in healthcare. That's when things get interesting, and that's when we start to move mountains. Telemedicine is huge, and we've had it around for a long time. We just never thought it was possible to use it for healthcare until now, when we were not left with a choice. Then we had to figure out, we had to reapply to healthcare. There's greener healthcare facilities, and that's the big challenge we have in Canada, the infrastructure that is required to make facilities that are greener, more sustainable. That's the challenge. The investment that's required has a huge price tag. But then again, comes down to in what time frame are you looking at this price tag? 10 years from now, we may have a completely different crisis that we won't be able to fight this one through. So applying that lens, yes, it makes prudent sense to make those investments. The reduction in packaging is a big one in healthcare that we're seeing. The plastics, using biodegradable material, green packaging, that's making a huge impact in the way we deliver healthcare. And also on the prescriber side, we have a younger generation of prescribers coming out, understanding what happens downstream once they write a prescription and give it to a patient. So having that lens as well, there's global organizations such as Healthcare Without Harm and Canadian ones such as Cascades that are focusing and helping healthcare providers solve these problems. We cannot do this on our own. Collaboration is the key, having very healthy working partnerships. And that's what we've been trying to do at HealthPro Canada as well, having global partners such as HealthPro Europe, trying to solve these big problems, knowing we can do it and knowing that we cannot do it alone, and knowing that we have partners that we can do this with is the biggest glimmer of hope that we can get out of this podcast.
Thanks, Alam. That's uplifting and is more than a glimmer, I think, as you describe. So I know we're getting close to time in terms of our conversation here today. I feel like we could keep this going for much longer because we've just touched the surface on so many of these topics and issues that are, so pervasive. But, maybe I can just sort of bring it back in terms of any final words that you want to share in terms of, the conversation we've had here today, and ask if there's either other thoughts or reflections on where we've landed so far. So maybe I can start with you, Kendra.
Sure. I think we've done a good job of creating awareness. I think we're at that beginning stage still. I think there's a lot of opportunity to do a lot more and in a more refined and focused way. But I think, just to summarize what it is that we do today, we provide data to assist with more informed supplier selection decision-making in a more sustainable way. That could evolve into making sure that there's more attention on the scorecard towards that, i.e. more weighting for the decision focused on that to help hospitals make more informed supplier selections, working with companies that are scoring better in sustainability. We educate, information share. We have several webinars in a year, as well as our sustainability rounds where we're engaging global partners as well as experts in industry to just provide their perspectives and just sharing that with the community at large. We don't really restrict registration on that. It's something that everybody should hear. So that goes right across the spectrum. I think it also becomes a collaboration and knowledge exchange. I can't think of anybody that walks away thinking, yeah, I knew that already, I didn't learn anything. There's always something to be learned in a nuance or in an approach or in a story or a case study. in these discussions. So it's still good to get together and just talk, simple as talking about your stories and what your progress has been in a year. I think we do a great job with advocacy and influence. We leverage that collective purchasing power amongst our members and talk to our suppliers in total about it. We offer public webinars where they can all attend and learn about the sustainability scorecard and why it's important and where it's going and how it's evolving. We're even looking to create an awards program that incentivizes suppliers who have shown year-over-year improvement or continuously score high based on our changing measures of sustainability as we evolve as a sector. I think where we stand to do better and where we'd like to go is in the data and reporting sphere. So being able to collect and process the data into information that can make better informed choices. Right now it's fairly manual, and I think we touched on that with respect to EMRs and the lack of connectivity in the system. A lot of these measurements are manual. There's not really a way to process them in a streamlined way. So a lot of effort goes into creating a very little bit of information. So that potentially could be, an area of development for us.
Thanks, Kendra. And yes, I mean, I know, and just for our listeners, this isn't an infomercial, right? But I think it is awareness building, and I think without being explicit, I think you've all made it, I think, very clear about the value that organizations like yourselves, can play within helping other organizations, address their impact on sustainability, emissions, or supply chain management positively. So I certainly would encourage any listeners who want to learn more about either HealthPro Canada or HealthProc Europe to visit our show notes and look at your organizations for more information, your leading practices, your advice and solutions that others and examples that others can learn from to certainly help them through this journey, because we're certainly all in this together. Any last words to you, Elisa?
Well, like really last words, because I think Alam and Kendra made absolutely the point. And what I would like to play back to you both is I think you're doing such an amazing job at your group purchasing organization. And for me, honestly, this is also where like a role model can take that lead of actually helping hospitals, of guiding the way, of, setting a system and a way to work, because I think this is so important to create that inspiration, to guide along the way, to make them feel that they're not alone, because this also from our point of view, being that association rather of the individual procurement professionals, this is what we see so valuable, because sometimes it feels awkward for one individual to put out a question because they're fearing like, oh, maybe I'm the dumb one here in the room. And actually we're not, we're all like new in this. And I think this is what I would like to give away. Ask your questions, bring in your ideas and your thoughts, because this is for all of us actually to start this, and this is for all of us to think about it. And this is like for us to leverage as a network of connecting the different dots, of creating the synergies and bringing out what each individual person, but also organization is doing to actually show the whole bandwidth of what is going on. And I think that's the beauty, like from a global point of view, that we're trying to leverage among our both organizations.
Yeah, and I think, not to overstate perhaps what should be obvious, right? But if our healthcare sector in Canada is 8 to 10% of our GDP, right? The strength of everybody sort of rowing in the same direction, making informed choices together around where we purchase things or how we do things, is a very strong incentive, right, for suppliers and others in the industry, right, to perhaps make changes. So there's a lot of influence in that space, and I think one of the key points that I've heard throughout the conversation here today, which is that, and I think as you've described in some ways, Alam, right, that we have two issues about people and planet, right, but that healthcare itself is an outcome, I guess, of sustainability, right? I think is in some ways, right? If we do the other parts properly and well, we will be healthier. And so the impact or performance of our health system and the health of our people will be reflected by the health of our planet. This is, so yeah, I've really enjoyed the conversation. Thank you for sharing your experience with me and our listeners here today, making something that is really, I think, quite complicated, with a lot of variables and aspects, I think a little bit more relatable, so that hopefully we can all take action together on something that is ultimately important to each and every one of us.
Thank you so much, Dale.
Thanks so much, Dan.
Thanks for the conversation.
Thank you. Take care, everyone. You've been listening to the HQ, and I'm Dale Sherback, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.